in response to these questions. Your question is related. Okay, now I take the last question.
I'm sorry, the question is related.
Good morning. My question is... Yeah. My question is about capacity building, in relation to your training modules. In my province, in Nueva Ecija, specifically in the city of Cabanatuan, where I am a counselor, we have caregivers and nursing students graduating yearly, totaling of 5,000 graduates, and most of them are females. And after graduation, they go to our hospitals for their OJT, volunteer work, for 2 years experience before they can get out of the country. So my question is, can we partner with you, or can we integrate your training module in the curriculum, nursing curriculum and caregiver curriculum? Because I'm also the Vice President of the Filipino Association of Health Caregivers, Women.
Thank you. Okay, now I pass the microphone to our experts. Who's that first?
I think I'll answer the first question, was directed to the whole program in terms of the other stakeholders related to it. You have what we call stakeholders that are parallel with you. That means the pre-hospital providers from security, rescue, police, the other local government officials, and then higher up from the hospital will be the Ministry of Health, the National Disaster Coordinating Agency for disasters of that country, the other agencies for government like social welfare and other agencies like education that you have to partner with. We're now and then lower down, of course, your personnel in the hospital, and then the community, which is the community base where the hospital is located. So basically what I'm saying is the hospital is part of the community. If you want to make your hospital safe, the community must also be a safe community. And I think there was a campaign years ago on safe communities and safety in school, safety in the hospital, safety in the home. This idea is now being propagated with disaster risk reduction principles that in all assets of our life, even in governance and women. So the stakeholders is the community. Wherever the hospital is, everyone in the community is a stakeholder of that hospital. Because if you get sick, your family gets hit by a disaster, you will go to that hospital. If that hospital is not safe or cannot function after a disaster, you have a problem. The second item is Governor Lee. For Region 6, which is Iloilo and Bacolod, we actually were spearheaded by the OCD regional office in partnership with the Department of Health regional director. So they shared in the funds. They shared their funds together and invited who they think needed to be trained. And then they created a series of programs until they developed their own instructors. In fact, the people from Region 6, we brought 2 to train people in Islamabad in Pakistan because they did so well in training. And then after all the training, the typhoon hit them. So I think because of that, they were already networked because both the government, the LGU hospitals and the private hospitals knew each other. Their resources kind of improved because if you know all your resources, the idea is you can share the resources and you can share what the other can do. So it improves capacity and capability. The third question, definitely yes. I think I told you my problem. I had to learn all of this disaster risk reduction after I graduated from medicine, after I had specialty training in emergency and trauma care. This should be incorporated into the citizens' education in undergraduate health professionals so that it will not be a problem later on as a corrective measure. It becomes part of capacity building of each country. So in fact, I think even high school, in disaster-prone countries like the Philippines, I think even high school people should probably learn about disaster risk reduction rather than marching around in other areas or doing some other activity. I think that's all the comments. Bibi?
Okay. As elaborated by Dr. Herbosa with the question, who are the stakeholders? I think it's everybody, no? Anyone who has a stake. But for health, anyone who is in the health emergency. So if I talk to the military, I talk with the people in the health side of the military. If I talk with the PNP, the police, that's helped the group also. But in all levels of government, from national down to the local, I think it's everybody. But as mentioned, the communities are the most important stakeholder. Now, there were a question of something about coping after disasters, about private issues and domestic violence. Let me tell you that in the Philippines, because I'm talking from the Philippines, we have a very good structure in disaster, from the top down to which is replicated from the national disaster down to the lowest level, which is the barangay. And along that line, we work closely with all the different national governments. So with regards to the psychosocial issues, which covers these areas, we have very good working relationship. So since the DOH now is the lead of the psychosocial cluster, we have very good close relationship with the other agencies. Now, just for a fact that, just for the record, DSWD takes care of evacuation center. The Red Cross in the Philippine setting takes care of community. Not necessarily mean they just take care of those areas, but that's their focus. That's your focus. The Department of Education takes care of the schools and the children, whether these children are in the evacuation center, and everything else is with the Department of Health. So we take care of the military, we take care of caregivers, we take care of the responders, we take care of local executives, and also the direct victims will be under the Department of Health. So that's how we work. And we also adopted the IASI guidelines for psychosocial, which means that psychosocial doesn't necessarily mean just debriefing, CIST, but we talk of psychosocial first aid, and this is what the DSWD is doing. Just the mere fact of giving food, of talking to people in the evacuation center is already a psychosocial first aid. So we are trying to develop those kind. Now, there's a question on hospitals, no access. But in disaster, in the Philippines again, I think this does not happen, very often. If they don't have access, actually national government from the region and the local goes down to them and really help them. Actually, I have some stories to share that it is during a disaster that some areas are really reached by people. So my team that went to Quezon actually reached areas that have never seen a doctor. So I'm not saying that we like disaster because it's the only time that they see these doctors, but during disaster, the more government tries to reach out to the people. Now, the request of Governor also, in my office, the one I showed you is only about hospitals. We also have a public health emergency management course, which is FEMA, which is also an adaptation from the region. That is a 2-week course in Bangkok that's given to all regional. It's a regional course. We are the first country that adopted into the Philippine setting, and as early as 2002, we conducted it in the Philippines. We tried to review, and every year we tried to adjust, and right now I conducted last week the 7th FEMA at a national. I'm so happy to tell you, Governor, that your provincial health officer was there.
Yeah. But what I want is not only the provincial
Yes, ma'am.
I would like the other staff.
Yes, ma'am. Imagine I gave up this trade. I am conducting two FEMA courses for all provincial health officers. That's around 80 provinces. That's my target from now and until November. The only sad thing is not all governors will be sending their PHOs. Half did not send their